A pain or discomfort that you're feeling on your teeth could be a sign of something serious happening inside your oral cavity. Hi everyone, if you're new here, hi, my name is Michelle and I'm a periodontist from Indonesia. So today I'm gonna talk with you about the pain that you're feeling with your teeth. Could that be something just, something to ignore about, or there's something to be concerned about? And today I'm gonna categorize two things and clear up about two things about discomfort and pain. So discomfort, if you're feeling something that is not right on your teeth or inside your oral cavity, but you're not feeling any pain. But if you are noticing pain, I'm gonna categorize it as two kind of pain, which is the first one if you're feeling sensitive, or maybe we call it as hypersensitive, and the second one if you're feeling pain, like a real pain. It's not just you're being sensitive to something, more sensitive or hypersensitive to something, but you're feeling an actual pain on your teeth. And if it's not including in these two categories, you can just say it as a discomfort. So make it clear, if you're going to a dentist, please make sure everything that you feel, you gonna tell it clearly to your dentist. So about a sensitive or hypersensitive, it actually could be triggered by something. So if you're saying that, oh my god, I feel a slight pain, triggered by temperatures. For example, if I'm drinking a cold beverage, or if I'm having a warm soup. So usually being sensitive or hypersensitive tooth is triggered by something. Either it's by temperature, by acidity, or by something that you drink or eat. Yeah, so it should be triggered by something, and the cause of this would be causing by a lot of things. Usually, maybe it could be because you're having a receding gum, or maybe you are having a tooth cavity. Either it's just the beginning of the cavity, or you already have a big cavity. So it could be caused by so many things, and if you're having sensitive things, usually it's gonna be triggered by something. And the second category, if you're feeling pain. So pain over here is you're really experiencing something that is painful. It's gonna making you feel ouch. So there's a thing, that's the difference between the two. And pain, it could be triggered or not triggered. So some of my patients, they could come up to me and say, like, for example, oh doctor, the patient A, they say, I feel pain if I'm eating something hard to chew. For example, if I'm chewing meat, and if I'm eating meat, or if I'm eating a burger, for example. But patient B, they could come up to me and say, doctor, I feel pain without doing anything. Sometimes it's just working, typing in front of my computer, and the pain just came. Or maybe patient C, they're gonna come to me and say, doctor, I feel a slight pain when I'm just going to sleep at night. Sometimes the pain just going to feel unbearable, even if I'm already taking a painkiller. So it just came out of nowhere without any triggers. Those kind of things are different. So the pain, it could be triggered, or it could not be triggered by anything. And then the second one, the duration. So some kind of pain, it could be last for like just few seconds. But other pain, it could be feel until like few minutes. It's unbearable. It's just hurting you so bad. Sometimes the intensity as well. So it's not only the duration, but it is can be having a different intensity, which is it would be feel really hurtful that even if you're trying to sleep at night, you cannot sleep. Or even if you're already taking a painkiller, the pain wouldn't go away. So there's gonna be something different. And when the time is occurs, would it be more intense at night, or would it be more intense when you were eating something? So those are the things that you need to notice from the pain or the hypersensitivity that is you're experiencing. And why am I talking or clearing things up about this? Because all of these things are different things that your dentist needs to know to diagnose what is happening inside your teeth. So here's the thing: if you're having a sensitive teeth, it could be triggered by something, and it could be causing by either you're having a problem with your periodontal problems, which is maybe your bone, your gums, or having a receding gums, or maybe you're having a bone problem, or maybe it could be because you're having a cavity. You need a fillings. You need to close the cavity, or maybe you're having a really deep, you're having a deeper cavity that is already interacting with your nerves, so it could cause you pain later on. So please notice the pain or the discomfort or the hypersensitivity kind of thing that you're experiencing with your teeth, and then consulting it with your dentist. So as I mentioned in the beginning, if you're experiencing pain or any discomfort on your teeth, it means something is going wrong on your teeth. So it's not something to ignore. Please visit your dentist. I mean, I have some patients that come to me like, "Oh, doctor, it's okay." I mean, if I'm just using a warm towel on the discomfort area or on a painful area, it's just gone away within a few minutes. So it's just gonna be okay after a few minutes. Would that be correct for not treating them and letting it be, because the pain could go away after a few minutes? Of course, the answer is no. It means you're giving time for the bacteria or for the disease that already happening inside your oral cavity to grow more and more and worsen and worsen. So when to see a dentist is when you're feeling any hypersensitivity, any sensitivity, any pain, unbearable pain, even it's just a slight pain, or even it's just any discomfort within your oral cavity, you need to visit your dentist. And if you're already having it, you cannot have an access to go to a dentist. What you need to do is to just brush your teeth well, flossing well, but you need to still visit your dentist. If you are not having any problems with your teeth, what you could do is to do a prevention, which is brushing your teeth twice a day and then using a dental floss, and also visit your dentist every 6 months minimum, at least to have your teeth checked up, because again, it is prevention. It is better than to cure the disease that already happening inside your teeth. So I really encourage you to do the prevention, because doing a dental treatments, I know it is never cheap. Okay, it's taking money out of your pocket. Either it's cheap or not, regarding to each individuals. But doing prevention is always better than for treating the disease. And the treatment, if you're already having a pain, if you're already feeling painful on your teeth, or maybe you're having a sensitivity on your teeth, the treatment would be all different. If your dentist is saying that, oh, you're already having a cavity, so the treatment option would be you're gonna have a fillings, dental fillings. Okay, not fillings. So you may be having a dental fillings, or maybe you're gonna have a root canal treatment. But if the cavity is really severe, is already taking up or eating up a lot of the construction of your teeth, part of your teeth, and it cannot be saved anymore, we need to extract it. As a periodontist, I don't want to extract your teeth, but if there is no tooth structure left to holding on, we need to extract it. But if your tooth structure is still good, is still intact, you still have full of your tooth structure, but maybe you have a discomfort because it already having a mobility, so your teeth is already moving here and there. Maybe it could be of the periodontal health issues, and you need a periodontal treatment, of course. So it depends on each cases, but again, preventing is always better than treating it. So please, if you're already feeling any discomfort, if your teeth already having a tooth mobility, if you're feeling hypersensitivity, or even more, if you're already feeling pain, don't wait to go to the dentist and make appointment with them so they could diagnose anything that is not normal going on your teeth, and then having a treatment as soon as possible. And my advice for you is to please visit your dentist minimum every 6 months for periodontal or for patients that is having a gum disease. You may or may not need to visit your dentist every 3 months regarding your cases. So I think that is for now. If you have any kind of question or something that is still unclear that you want to ask me, you can just ask on the question on the comments below, or maybe reaching out to me on my Instagram. Okay, I think I will wrap it up over here, and see you guys in the next video. Bye.